Hi, good morning. My name is Kike, your host today on the podcast White Reflections by Hadufe. White Reflections by Hadufe is a podcast that delves into the complexities of life and modern day living. As you know, what we try to do on the show is we try to bring people with real life experiences on the show to share their life experiences. Perhaps somebody going through something similar can benefit from it. We also try to bring in experts to come in and educate us about life situations. Perhaps also somebody going through something similar can benefit from it. Today we shall be unveiling the health issues faced by women beyond biology, the common health issues faced by women. And today joining me on the show is Dr. Yewande Shobowale Lafinho. She's a medical doctor, University College Hospital. She shall be talking to us about the common health struggles faced by women. Thank you, Dr. Yewande Shobowale, for coming on the show.
Thank
Dr.
you.
Lafinho.
Thank you, Kike. Nice
Dr.
to
Laugh.
be here. Nice to be here.
Our petite Dr. Laugh.
Nice to be here.
Thank you so much.
Yes, so
it was a short notice.
I know.
Then you made yourself available.
I tried to remember all my embryology, anatomy, and everything just to, make this possible. So, the issues women face. Just yesterday at work, me and some of my colleagues still had this discussion. And, despite the numbers, the millennia women have been alive, our issues seem to always be put like on the back burner. People don't take it seriously because they feel, well, it's period pain now. Is dysmenorrhea? Can it be that bad? Especially by men. We tend to be written off or just, push aside, especially when it comes to workplace or school. And you say because of dysmenorrhea, you can't be at work today or you can't be at this class. And people just dismiss it like,
what's menorrhea?
Dysmenorrhea is period pain.
Period pain.
That's the scientific name for period pain. And it's quite common for a lot of people. For some people it's mild, that they can, still function day to day without any problems. But for some people, there are always outliers in every situation. The outliers on one end are those that don't experience period pains at all, don't experience any PMS or anything. I fall into that category. I don't have pain for one day. My day 1 to 30 is the same. I don't have any changes in my body that I can say. But then you have people who are in between, and then those that are on the extreme when they're on their periods, even before their periods, what they call premenstrual syndrome, that lasts from like a week or 2 before the periods. They are nauseous, they are irritable, they, some even go into depression, some vomit, some are in severe pain, some have constipation. There are so many
Some
things.
Even have to get to the hospital.
Yes, some have to be admitted while they are on their periods, So it's like a wide spectrum. But the fact that most times it's dismissed, especially by the men folk, is really upsetting because it can be really debilitating. I know for a fact that I think Spain has passed a bill that gives you period leave. So many days in a month, every woman is entitled to go for a few days, get herself together and come back to work. And I think that's a step in the right direction because some people really have it bad.
Thank you very much, Doctor. I love being a woman. Absolutely. But the other side of it, the flip side of it, to be honest with you, I would rather trade it. I used to have bad period pains when I was, a teenager and, into adulthood as well. Really, really bad period pains until I had my first child, and then it subsided. And I know for a fact that there are people who still have it even after childbirth.
Oh yeah.
There are people with irregular periods.
Yeah.
There are people who do not even see the period at all.
Exactly.
And I always ask, does a woman's body, does it ever rest? Because we have all these hormonal changes, from what's it called, painful periods to irregular periods to absence of periods to PCOS to hormonal disorder to UTI and all of that. And I'm looking at a woman and I'm saying, your body Does it ever rest?
Yes, I get you.
And then we have these many moods, moods before your period comes and the moods after. And I always say to people that a real man needs to understand a woman, the physiological makeup of a woman, if you really want to live with a woman, because it just never ends. And that's the way I see it. So I want to ask, doctor, you just mentioned to us now that you don't experience pain. Is that as a result of what you eat? Or is it genetic?
I think mostly it boils down to, it probably is genetical, because growing up, I don't recall any of my sisters also having period pain, and I never saw my mom down, at least while I was growing up, while she was still, in the reproductive age group, complaining about period pain, as in there was never any painkiller in the house that you see someone taking during period. So maybe it is a genetic thing, but I know I don't experience it. Doesn't mean that I dismiss others who do, because even month to month, your hormones fluctuate. Your hormones fluctuate based on things as simple as stress. Your hormones fluctuate based on the food you eat. Your hormones fluctuate based on the numbers of hours of sleep you have, so every month, a woman might experience something different. A man might be married to a woman who maybe it was mild, nothing serious, but then maybe by the time children come, lack of sleep, stress and everything, then she now starts having these mood swings, and he's wondering, but you are not like this now. Kike, when I married you, you were not like this. But he's failed to realize that there are so many factors that are now, playing with your emotions, which include your hormones. So if you don't sleep well, definitely cortisol will be high. It will reduce the level of your sex hormones, which are your estrogen, progesterone, and it can affect your cycle. The same way with the food you eat, if you fast for prolonged periods, definitely your body will see it as it's in starvation mode. So it might prevent ovulation, because women, no, if you are fasting for a long period, or you are on all of these fat diets that they say you eat only so many hours a day and stuff like that, eventually for some women, their periods will stop because your body gets the signal that you're not getting enough food. So you shouldn't get pregnant because you won't be able to carry a pregnancy to term. So your body shuts down by itself for your own good, because Anito Kanu is the one that wants to have a baby. What's she going to feed that child?
So you cannot fast if you want to get pregnant.
It shouldn't be prolonged. It shouldn't be prolonged because your body needs all the nutrients, and fasting or hypoglycemia or not getting enough nutrients messes with your hormones. So of course, what we also eat, there are so many other things we eat now that are laced with hormones. Some of the meat, especially the processed meat we eat. Our country, well, we can say we are still blessed. Our cows are grazing freely, but in developed countries where they farm them, it's large scale, they inject them with hormones to make them produce more milk, have more meat and stuff like that. So when you eat a lot of dairy that is, foreign, it also tends to mess with your hormones too, which is why infertility is on the rise, which is why things like PCOS are on the rise, because you're getting these hormones through your food, and those are synthetic hormones, and meanwhile they are playing pranks with your body's natural hormones, and then the imbalance comes, and then you start having all sorts of issues. So diet, lifestyle can affect a woman. So a woman you met today, happy, no problems, 5 years down the line, based on what she's going through, might be showing you a different side to her, not because she wants to, but she can't help herself. We're talking if it's something hormonal. I can't wake up today and say I will not be cranky. If I have PMS, yes, I will not be able to help myself except by the grace of God. So if you step on my toes, what I might overlook the first day of the month, on day 20, I might not overlook that same thing because my hormones are different from day 1
it took me
to
a very
day
long
20.
time to notice that about myself.
Okay.
And then after which I realized that, so it's this thing that is causing, because when it's fast approaching, I'm a different person.
I know.
And it's not something I can control, to be honest with you, because it just comes on to me naturally. I try as much as possible to,
keep it.
I mean, so at some point I started to, give
Keep
it
track.
a track, to keep a track of it. And I realized that that's it. When is that time of the month? I'm usually very cranky. And another thing is, I'm always very sensitive. I want my environment very neat. So, you see me cleaning after myself, just making sure that everything is really good and nice. And I know that some of my other friends have other symptoms too. Weird symptoms like
Cravings. Some
and
people
all
start
of
to
that.
crave
Even
chocolate
smell.
or
Some start to have, I think,
yes,
sense of
smell.
and all of that. So I knew all of that. And that boils down to the fact that we still need to understand our body and keep it track. Now that you've talked about diet, what are the kind of food that we can feed on?
Your best bet.
That can help our hormones.
Your best bet.
Exercises.
Your best bet are still your fruits and your vegetables. You can't go wrong if you have a healthy balance. Yes, some people feel I don't like vegetables too much, and the idea of vegetables is effort. But vegetables can be your cucumbers, cabbage, carrots, because carrot is a vegetable, green peppers, red peppers, lettuce. Just try and have a mix of salads. I know a lot of us gravitate towards more fruits because they are sweeter and definitely probably easier to consume because you just wash an apple and you go your way. But if you want to have a salad, you're going to chop lettuce, chop cucumber, chop tomatoes, and it takes a whole lot of work. But you're better off eating that class of foods. A little fruit, yes, you need the sugar and some of the nutrients, but fruits mainly would do the work. Then another thing that a lot of us lack in our diet are nuts. We need nuts.
Nuts,
cashew nuts. If you can afford almonds, pistachios, a lot of the tree nuts, because we have this idea that groundnut is a nut. Groundnut is not a nut, it's a legume because it grows in the soil. Unlike almonds, pistachios, they are from the seeds or they are from fruits. So by the time you eat walnuts, they grow above ground, and those are healthier for us. So cashews, which we grow here, is fine. But if you can afford it, go ahead, buy your almonds, buy your pistachios, buy your walnuts. Even asala that we have is very good because it's like our own local walnut, the tropical walnuts. What those things contain are the essential fatty acids, especially your omega-3, 6, and 9. But most contain 3 and 9, which are the beneficial ones. Those ones are anti-inflammatory, while the 6 is pro-inflammatory. So they advise you less of 6, but more of 3 and 9.
What are the examples of this?
The fruit, the nuts. The nuts are examples of 3 and 9. You also have your oily fishes.
So which is important for us? The 3 and 9.
3 and 9.
Okay.
So
the cashew nuts.
All your nuts.
The almonds.
Yes, they are fine. Okay. Even coconut contains essential fatty acids. Avocado, the pear we get here, very fantastic. So if you eat more, especially towards when your period is starting, like mid-cycle, trying to ingest more of those oily foods, you find that the PMS levels or the effect tends to reduce. Because what those things do is they are important in formation of hormones. The building block of your estrogen, progesterone, testosterone is cholesterol. And the building block of cholesterol are these fatty acids. So if you feed your body these fatty acids, enough of it, the good ones, it will translate into good cholesterol, which will go on into production of your hormones. So some people, the reason why they have this PMS is a derangement of the hormones. But when you put enough in your body to produce your hormones at the levels it should be, you find that those effects are minimal, if not almost non-existent.
So what you're telling us, Dr. Laf, is that with diet, can you reverse things?
Yes.
You can.
Yes,
it
can be worked on. PCOS in particular can be worked on with diet. There are some if
without
people,
medication.
Yes, if people check online, they can find out some PCOS regimen. There are some things they will tell you not to take, like white sugar, for example, any sweetened things. So we are drinking juice, we are drinking Coke, we are drinking this. It's all about, being disciplined. But if you can and you follow this regimen, you find that you can mitigate a lot of the signs and the symptoms just by controlling
What
your
about
diet.
Greek yogurt?
Greek yogurt is fine because it's dairy, and then of course it has some microbes that are beneficial to your gut health. And once your gut is healthy, the rest of you is likely to be healthy if you eat well. But a lot of us eat a lot of junk. We do a lot of sugars, we do a lot of sweet things, we do a lot of breads. Personally, I tell people, if you can remove bread from your diet, your life will be much easier and better.
Bread?
Yes. Bread contains a whole lot of sugar. It's white flour, doesn't contain any fiber. And then a lot of the bread makers here, to cut corners, they put a lot of all these additives. Then the margarine they use or the oils they use to make the breads are not things that if you see you would want to eat, you know. So, but mainly because of the sugar content in bread. You eat 4 slices of bread and you feel like, you know, some people, they've just started. 4 slices, you can't do them anything. But in those 4 slices, you've eaten so many cubes of sugar, which messes up, yes, your hormones. Even wheat bread that people talk about, oh, it's the healthier version. Wheat bread is wheat bread because they use less coarse flour, one. But to give it that brown color, they add molasses, which is sugar also, just the brown, raw sugar. So at the end of the day, you're still getting the same amount of sugar. And in fact, because they use molasses, they have to use more of it to get it really sweet than the regular white bread. So I tell people, don't deceive yourself. Eat your white bread. But that wheat bread, except you bake it yourself, don't go there.
Thank you, Dr. Laf. This is like, this one I'm about to ask you is like a big one. And you know, I know a number of women even prepare for it. And I'm talking about the menopausal stage, to, you know, getting into menopause itself.
Okay, so
I know somebody who said to me that she was at that stage for more than 10 years, the menopausal stage. And at some point, she didn't know what was wrong with her. She kept going in and out of the hospital. You know, she would have hot flashes, night sweats, you know. And I know a friend who is, you know, in the middle of all of that right now, you know, and it's been ongoing for 2 years, and she's still there, and she doesn't even know when
it's going to end. You know, that's
a woman. It's just,
I know we have, you know, from menarche, which is the age you start your period, till after your periods end, we go through a whole lot of changes as women. Menarche for people, when our mothers were younger, some of them didn't start their periods till they were 17, 18. But gradually, and I believe diet has a lot to play with it, you know, to do with it. The age has gradually been reducing. Right now, menarche is from age 10 to 16. Girls as young as 8 now are seeing their periods, all because of what? It's not, because the younger you are, the longer your body is exposed, your sex organs are exposed to these hormones, these female hormones. And a lot of these hormones feed some certain cancers, like breast cancer, like ovarian cancer. So if from you start your periods at 8, then you're exposed to these hormonal changes longer, and your chances of developing either breast, ovarian, or uterine cancer are higher than someone who started a period, let's say, at 13 or 14, barring if maybe you have some genetic predisposition to these cancers. So that is the problem with starting periods too early. But now we are seeing it amongst our young girls, 8, 9.
Why?
Diets. A lot of us are being fed, when we are young, we are fed powdered milk, which is from cows that are hormonally injected. So we are being fed a lot of foods which are, you know, infiltrated with a lot of hormone stimulating effects, like milk, dairy, meat. You know, when our parents were growing up, they hardly drank milk. Meat was, some families, meat was on Sunday with your rice. Rice was once a week. But now rice is almost every day for the average family. Bread is almost every day, you know. Then of course we've exposed our children to drinking Coke, Chivita, so many of these things. Meanwhile, the fruits that are being used to produce these things are exposed to a lot of herbicides, you know, fungicides, all sorts of things just to make them grow well. So we're ingesting toxins, and those toxins are messing up with our hormones. Even with the boys, you now have boys approaching puberty earlier. You have an increased incidence of prostate cancer and so many other things that are happening even in the men folk. So menarche now has dropped, and it's probably going to keep dropping as the years go by. God help our girls, because really, what can we do? So you start at menarche, your periods come, goes, you do whatever, then you now reach what we call the climacteric, which is pre-menopause. So what a lot of people don't realize, what I try to educate a lot of my patients who come is, you will know your climacteric, which is your pre or perimenopause. We call it pre and post menopausal period is called the perimenopausal period. What you do is you add 35 years to the age you started your period. So let's say you started your period at 13. You add 35, so that gives you 48. A woman's reproductive cycle is give or take 35 years, plus or minus 5. So if you have 48, if you minus 5 from that, you have 43. If you add 5 to that, you have 53. So for you that started at 13, your perimenopausal period is from the age of 43 to 53. That means in between that time, your periods can stop. You can hit menopause. It might not exactly happen to you that way. It might take a bit longer, maybe 54, 55. But that time, your periods start to kind of misbehave. It's no longer regular. And then some people start to have all these symptoms, the hot flushes. So what I tell my patients to do is fortify your diet. Your diet is still the best weapon you have to fight against all these things. Eat a lot of these fatty foods, a lot of fatty fish. The fatty fish we have, thank God that we have them in the market. The acronym I use for it is SMASH. So you have your sardines, you have your mackerel, you have your anchovies, you have, what's the name of this one? Salmon and herring. In our market, what those fish are called, your kote, your alaro, your sardine, and your express. There are about 3 or 4, but we have them. Hake, yes. So we have them in the market. So, when you are the only one that have salmon, well, you have alaro, you have the titus, you have your sardine. Those are oily fish. So if you include it in your diet with all these other things we mentioned before, go to the market, go to dinner, salad is in season, buy it, boil, cook. It also contains those essential fatty acids. If you are not an avocado person, try. It's for your own health. Incorporate avocado pear into your diet. Then of course, nuts, plenty water, and exercise. You cannot remove exercise when you're talking of managing menopause, because as you age and your estrogen levels decrease, estrogen is what keeps us women from having a heart attack, unlike men the same age we are, because estrogen is sort of like cardioprotective. So women suffer less heart attacks than men, their same age group. But as you age and your estrogen levels falls, you and men are at the same risk. Also, estrogen causes the absorption of calcium from your GIT, from your system. So women who are reaching menopause need to bulk up on their calcium by taking foods that are rich in calcium, things like cheese, wara, milk, dairy, liver, that on the other side. But you need to exercise, because once you hit menopause, your calcium is going to start to leach from your bones. And then you have what is called osteoporosis, which is why if you notice, as women grow older, we tend to shrink more than our male counterparts, because their bodies have been used to this calcium leaching over the years, because they don't have much estrogen like we do. But we have benefited from estrogen by building our calcium, so that when it now dips, the effect is seen faster and quicker in us. But with exercise is what you do, strength training. When you strength train, you force your bones to develop and to become stronger. And what your body does is it absorbs calcium on its own because it's trying to feed your bones. So you do strength training, you do jogging, you do exercises, not walking. Walking is not a strength training exercise. You lift weights. You get your muscles and your bones to demand this calcium from your system so that it can store it.
You lift weights?
Yes. It doesn't have to be anything big.
Okay.
Weights.
Those light dumbbells?
Yes, it could be light. But, of course, when that becomes easy that you can be talking to your sister on the phone and be lifting weights, then okay, you've gone past this weight. Let me increase it a bit more. Maybe from this one, I move to the 1.5 liter bottle. You don't have to buy any special equipment or anything like that. Even at home, you can do body, what they call body weight exercises, that you use your body, do lunges, do some glute exercises, stuff like that your body is the weight you are using, So we just always have to incorporate that. A lot of us look into the diet alone and forget the exercise part. Well, the exercise part is equally as important as the diet. So when you've put all that in place, even before the menopause hits, you are eating properly, your diet is rich in all these fatty foods. Not fatty foods as far, okay, I can now be eating meat indiscriminately. I've talked about the particular types of fats that you need. Not I'm frying meat, I'm frying chicken.
I'm even frying fish.
I'm frying fish. No, you don't need all that. But eat the right things. You find that by the time menopause hits, the effect on you, yes, you'll be ready, But another thing I also tell people who menopause has hit or is very close and they haven't done that over the years is there's this supplement. It's called oil of evening primrose. It comes in like a capsule. It's an oil, it's from a plant. But what that plant is it's rich in plant estrogen. There are different types of estrogen. There's the animal and the plant. The plant one is called the phytoestrogen. But when you take it, it mimics your body's type of estrogen. So I tell my patients, you know what, you're probably going to have to be on oil of evening primrose for a few months. It's a daily thing. Take one daily for like 3-6 months, depending on how bad the symptoms are. Yes, but you can start from any age once you hit your perimenopausal period. So that
when is that? When do women usually hit that period?
That's what I explained to you earlier.
What age?
Based on the time you started your period, then you add 35 plus or minus 5. So it's a spectrum. I started at 11. My 35 years will make it 46. So for me, perimenopausal will have started from my 41st birthday till my 51st. So I'm in between. Even now, my periods are not regular. They do what they want. I know any day now is
but
probably
do you experience all this?
I don't, because for people who know
very
me,
intentional.
I'm very intentional about my diet. I don't eat bread. I don't drink juice. I've not had Coke in 11 years. Wow. I've not had juice, Chivita, any of those things. It'll be 11 years, July 1st. I've not tasted it. I don't crave it. So there are some things I cut out from my life because I know this is what I want for myself. And for me to get there, right? Yes. And for me to get there, I need to put some things in place. So it's a sacrifice. But some people feel, is this one life, Joe? Let me enjoy myself. I can't do without drinking.
So what do you eat, doctor? You take a lot of rice? Do you take rice?
Rice in my house is once a week. When I tell people are like, so how do you manage? What do you eat? Okay, for example, in my house, we do rice once a week. But we also do yam. We do pasta. We do beans. I like beans. My husband and my children like beans. But we do a lot of salads. So some days we could do sweet potatoes and have coleslaw with chicken or whatever. On some days, it's basically just salad. I tell the boys, it's salad today, and we're not having anything with it, maybe chicken or fish. For them, because they are children and I don't want to deprive them, the only bread allowed in my house is the shawarma flat bread, because I know that one doesn't have much sugar, if any sugar at all. There's no yeast, there's no sugar, and they are not adding any bromates to make it rise or anything spectacular. So that is the only condition for bread in my house. It must be accompanied by vegetables. Then we do a lot of grains. I do pap once a week, we do oats. Then I buy some of these foreign grains like quinoa, bulgur wheat, we just...
Broccoli.
Yes, of course, vegetables are a must. In fact, my kids, if you give them rice and give them salad, they will eat their salad, then they will leave the rice. And I have to tell them, you still eat your rice. That's how much they love vegetables. Then they take fruits to school every morning. We have to eat fruits every day. We eat fruits every day. We eat vegetables in one way or the other every day. Then, of course, like we said, fish, chicken, and stuff like that. Then, of course, nuts. So my house is full of, I have almonds, I have pistachios. Anybody traveling, anybody come back, I said, you don't owe me clothes, so you don't owe me shoes. Just buy me nuts, buy me seeds. So raisins, we do a lot of cherries,
granola?
Yes, I make my own granola.
Oh, okay.
So I always have my nuts and my seeds and my dried fruits that I mix in it. That's what I had before coming this morning. Then I also make my own yogurt. So yogurt too, Greek yogurt is fine. So it's about you. I think what works for a lot of people is drawing up a roster and sticking to that roster. So we have yam. Sometimes it could be just yam and stew and egg. And sometimes it could be pottage.
Okay.
We have beans. We fry plantain. We eat sweet potato. We just mix it. I try to make sure each meal is not more than once a week so that they are not tired and say, oh, Mom, it's rice again. Or it's because my kids can be good at that. Mom, beans again? I'm like, yes, beans again. So with my beans, I also mix lentils. That I buy you can get at Wimpy's or Bazaar, just to get a more richer, fuller.
And something different.
Yes, something different. So we do a lot of that. So basically that's it. But fruits and vegetables are a must. Even my colleagues know, they're like, nothing to eat day. What is this one like that? This one is quinoa, or this is this. So basically that's it. So we as women, we can help ourselves. I don't know, maybe it's my lifestyle that has made it, easy for me to go through what I'm going through without any
I think it has contributed
of this, but I know it helps. It does help.
Thank you, doctor. So very quickly, I also want us to talk about the vaginal health of the woman.
Okay.
Coming down with UTI, bladder infection, and all of that. And I know that pregnancy predisposes the woman to all of this infection.
Yeah.
And there are also, times when even after you've given birth, some of these hormones don't even go down. Like the thyroid hormones, keeps fluctuating, and then so many things after pregnancy. How can a woman deal with that?
Okay, so now, for example, in pregnancy, what happens is your hormones, there are some hormones that increase in pregnancy to a higher degree than some. So you have your progesterone, you have your estrogen. In pregnancy, your estrogens definitely increase because that's what sustains the pregnancy. Your progesterone increases too, but to a lesser degree. Now, your regular vaginal flora, which are the microorganisms in the vagina, are also affected by hormonal fluctuation. So they go along your regular cycle. The first stage is your menstruation, then you have your follicular phase, which the eggs are being primed, ready to be released at ovulation. Then you now have the luteal phase, which the wall of the your uterine wall is degrading, preparing in time for menstruation if pregnancy does not occur. So what happens is, in pregnancy, because some hormones are higher than some, the microorganism balance also changes. So which is what predisposes women to these vaginal infections in pregnancy. Then there are some organisms we call opportunistic infections, which are the fungi, the candida. They are there normally, but if your regular microorganisms are flourishing, nothing is affecting their levels, they keep down the level of candida and all those other ones. But when those ones when they suffer, then the candida and others now have an opportunity to proliferate. In such instances, you find that the pH of the vagina decreases, which is why candida and stuff can now thrive, which is what happens in pregnancy, which is why vaginal infections are common in pregnancy. It's not something you can help, it's just a physiology, it's what happens. So what do? Take your medication, practice good personal hygiene. A lot of us women find that when we use the toilet, even when we pee, some don't wipe up, some just, wear their underwear.
What is the best thing to use when you're not at home?
When you're not at home
water,
and you can't use water, you're still better off at least using tissue.
Okay.
If you're the kind that you can get all those pocket wipes, not the ones that are scented or have any alcohol, you can have those small pocket wipes in your bag. It's best if something moist cleans off the place, and then you
Other than using tissue.
But of course, tissue is always better than nothing. Then a lot of us, when we do the big job, number 2, a lot of people wipe from back to front. When you wipe from back to front, you expose yourself to fecal matter. Fecal matter contains so many organisms, from the ones you put in your mouth, everything. So it contaminates the place, and they now thrive because they are more virulent than the normal ones living in your vagina. Nothing spoiled. They've been there for decades. We are fine. We now introduce the ones that have teeth. By the time they come, they just take over the place. They disrupt the whole system, and then you have UTIs and increased incidence of vaginal infections. So personal hygiene is where it all starts from. Always clean up, even if it's peeing. Clean up, because one, moisture is what all these fungal organisms thrive on. So if your underwear is constantly wet, constantly damp, you are breeding these things without you knowing, and eventually you're going to come down with it. So clean up properly. If you're at home, I prefer use water. You're in your house.
Exactly.
You finish, wash your hands. But if you're in a place where you don't have access to being comfortable sitting down, using water and all that, at least clean up with tissue. When you do that, you find that the incidence of UTIs or vaginal infections are almost zero.
Vaginal wash.
Those things are terrible, and they should be avoided, because what they do is they change the pH, which is the acidity or the medium of the place. Vaginal whatever is usually basic, but when you do
self-cleansing?
Yes, because when you now introduce, number 1, whatever you've used to introduce will carry bacteria. It's not well, except you sterilize it before, but most women don't. They just remove it from the container and they use it. So already you're introducing bacteria. Then the water or whatever liquid is there is washing out the useful bacteria to you, and is changing the medium of the place. So repeated douching or cleaning is detrimental to the woman at the end of the day. Your body was created, when God created you, he didn't say you use this to wash this.
You really don't need to.
You don't need, you don't need it. Our forefathers, Eve, didn't do any of that, and we're all here today. I'm sure she didn't, because
you weren't there, Dr. Now.
What would she have used to even do it in the first place? Do you understand? As in, when you think about it, there are some things that are more of like modern invention, or some people's thinking that, no, if you use all these things, it will clean the area, it will be sanitary. But the science tells you the place has to be occupied by microorganisms. So why sanitize it? It's just like when you take antibiotics repeatedly for a long time, you are sanitizing your GIT. Your GIT was not made to be sanitary. It was made to have microorganisms because they aid in the digestion of food, which is why you see people who use antibiotics for a long time start coming down with diarrhea, because the food can't be digested. As you're eating it, it's coming out. So God created us. Everything has its use, and everything was made to function in a certain way. It's when we deviate from it that we have problems. Even simply cleaning your ears were made to clean themselves. That's why you have hair cells, and they move in an outward motion, which is why sometimes you will do like this, you will see wax, because it has brought it from inside out. But
so you don't need to use the cotton bud to clean?
I've not cleaned my ears in over 20 years. And I've never cleaned my children's ears. And I don't come down. I used to have ear infections prior to when I stopped, until my ENT surgeon said, you are not made to clean your ears. Your ears are made to self-clean. But when you take that cotton bud and you put it inside, you are pushing in the wax, pushing in dirt, because not like the cotton bud is clean, it's not sterile. Most of us can't even sterilize the things we use. So you push it inside, you push germs, you push the wax, it now impacts, then you become, I'm having pain. Headache, this place is paining me. Because you've cleaned your ears when you were not meant to. So the body, God created it in a way that if we just leave it as is, we would have less problems
than we have now.
Yes, exactly. So with the same thing with UTI, of course, frequent sexual intercourse, multiple partners predisposes us to having all these vaginal infections and all that. That is whoever's prerogative. But if look, I'm faithful to one person, then you shouldn't be coming down with those things as often as possible if you do the needful, which is keep yourself clean, proper hygiene and stuff like that. You'll be fine.
Thank you very much, Dr. Mark. I mean, this has been very insightful. So, lastly, I want you to talk about cysts.
Okay.
Yes.
So,
and fibroids.
Okay.
Ovarian cysts.
And fibroids. Okay. So, cysts occur normally. If you know the female reproductive cycle, from when you menstruate, the hormones start to increase. And what those hormones do, your progesterone, your estrogen, is to start preparing the eggs, or what we call the oocytes in your ovaries, to mature and to be excluded from your ovaries so that conception can take place. In some cases, and when that happens, it is enclosed in like a sac that contains some fluid. That fluid is what sort of like nourishes that particular egg that was chosen that month, or the eggs that were chosen that month to occur at ovulation. So, but sometimes because of hormonal imbalances, and like we talked about our diet, sometimes more than multiple cysts or multiple eggs are being developed at the same time at different stages of development. So when you take a scan of such an ovary, you will see them pop out like how you have measles, if I can use that, on the surface of the ovary. Those are cysts, because that's how the normal, the 1 or 2, if you are predisposed to twins, should be. It should just be fluid filled, the egg is inside resting, waiting for that cyst to open out, and the egg is, released. But now in some people, because of hormonal imbalance, they have so many cysts developing at different times. So if you do an ultrasound, let's say on day 6 or day 7, they might find a cyst there. Okay. Doesn't mean if they do it a few days down the line, you will not have normal ovaries. So having a cyst on your ovary is not like it's a sickness, if I can call it that way. If it's a simple cyst, there are different types of cysts. Dermoid cysts, complex cysts, there are so many. But the average woman should have a cyst on her ovaries at least every month if she's ovulating. Now, some people have what we call this PCOS, polycystic ovarian syndrome. In that one, the hormonal balance in the body is what is causing the ovaries to produce multiple cysts. So it's a syndrome because you have so many other symptoms attached with it. So in such women, most of the time you see that they are obese. A lot of the time, their blood sugar is always high. They're always in the pre-diabetic range of blood sugar. Some of them have male hair distribution. They have excessive hair growth. They are very hairy and all that. Because of those hormones, they're just playing trancy with your system. Then a lot of them also have infertility as a problem, because these cysts are producing, your body feels, it's about to get pregnant. The hormones they play topsy-turvy. So one releases today, one might release 2 days later. It messes with your system. So ovulation, you can't even tell when ovulation is. The time you are to menstruate might even be prolonged, because if one was released today, you expect to menstruate in 14 days. But if another one is released 5 days later, it's prolonging, so your menstruation. So you have irregular menstrual cycles. That is different from polycystic ovarian disease. That one is a primary disease of the ovaries. They are the ones producing so much hormones that is now affecting the number of cysts they are producing. So that one, with some OCPs, they rest the ovaries for a while, put you on oral contraceptives, rest the ovaries for a while, then everything can now balance. For PCOS, it's a multi-dimensional treatment. For the sugar, you have to be put on drugs that they use for diabetes, such as metformin. For the hirsutism, which is the excess body hair growth, you might have to abroad do laser therapy to remove the hair, or you have to be shaving a lot and stuff.
Will it grow back?
It will grow back as long as you're not managing the condition. Okay. Then for the other things, like I said, diet.
Which is even the most
Which is the most important
so far.
Your diet. Once you can control your diet and get things in place, you find that all those symptoms eventually will.
And with fibroids?
Fibroids, the thing about fibroids is it's a benign growth. For some reason, Black women are predisposed to it more than whites. For some genetic reason, I don't know if they found whichever gene is responsible for that. But we are told that if you put 100 women, do an ultrasound, you might find like 90 carrying fibroids. But most times these fibroids are asymptomatic and they don't cause problems. The average woman will have fibroids and she will go through her reproductive life and not know she has a fibroid if she doesn't do a scan. Small and they are harmless. But some start to become problematic because they cause prolonged bleeding, heavy bleeding, painful periods, cramps, and so many other things. Then some even grow. I've seen fibroids that grow to the size of a baby. So such a woman, definitely she can't get pregnant because there's no space for the baby to stay. So, it causes infertility in some only if it's problematic. So with that, if you have a problematic fibroid, if it's not too big, some hormonal treatments like there's this IUCD they call Mirena. It's coated with progesterone. It will release progesterone into the uterus, and so it will reduce bleeding. So it might help a situation if you have heavy or painful bleeding. It helps with that. But if your fibroids are now so big and so huge, surgery is always the only solution.
And I hear that when after surgery, it can come back.
Oh yes, they recur. So you do a myomectomy today doesn't mean 2-3 years from now you won't find another fibroid. Except you do. If you are radical and you're like, you know what, I'm done, I already have 10 children, or even if it's one, but you know that fibroid is almost taking your life. Because there are some women, when they bleed, they have to admit them, give them blood, all because they are having periods. So it can be really bad. So, so some might decide, you know what, God has blessed me, I have two. There are 2 boys, I don't need that girl in my life. I would let them just take out this thing. So when they take out the ovary, when they take out the uterus like that, usually they take out the ovaries too. But sometimes some people leave it so that they won't go into menopause so rapidly and they won't have all these menopausal symptoms like so quickly. So there are different modalities, but you discuss with your surgeon what you want.
The best
option for you. For some women who have had a history of maybe breast lump or cancer, you are better off removing the ovaries because you'll still be producing estrogen that can feed those cancers. So some people say, well, you remove everything. I don't need any of it. Take it.
Exactly.
So and I'm done of all these cancers. Okay. So there's so many menstrual irregularities. Amenorrhea is one that it doesn't even show up at all, which a lot of people with PCOS have. Some see their periods 2-3 times a year.
And that's not good.
It's not good because how do you know when you're going to get pregnant? How do you know when you're ovulating? How do you know? So it's crazy. Some people have what we call hypomenorrhea. The frequency is reduced, so it could be every 2 months, every 3 months. Some have hypermenorrhea every 15 days before you've seen another one, So there are also many types, but whatever the case may be, the regular cycle should be between 28 to 34 days. So if yours is falling outside that, then you need to see your doctor for them to put you on hormonals that will regulate it and put it back in sync, except you don't need it. So someone like me, my periods are no longer regular. I don't need it. So
exactly.
I don't need to go to anywhere. When it's ready to pack his bag and go. So I'm at that stage in my life.
Thank you so much, doctor. Thank you. So basically what you told us today is that women, our hormones, they're always, all over the place. But with diet, exercise, and lifestyle modification, we can correct it.
Sure.
Thank you so much, doctor.
You're very welcome.
On the show.
You're very welcome.
This has been really insightful, and I'm still going to bring you back.
No problem.
Yes.
I would love to come back.
Thank you so much. So you've heard it from Dr. Laf. You really don't need to stock up on all those medications. Lifestyle modification, proper diet, exercise, you can reverse any medical condition that you're dealing with. Thank you so much. This is coming from a doctor, so I didn't say it. Coming from a doctor. And of course, I'll put Dr. Lafinho's details on my page on the YouTube channel. If you need to contact her, she's always ready to help.
Sure.
Thank you, Dr. Laf.
You're very welcome. I really enjoyed it.
Yes,
Thank you.
All right. Bye.
Bye-bye.